Hi, my name is Tristyn and I'm going to be inserting a nasogastric tube today. So the first thing that I'll do is assess my patient for their gag reflex, if they have had a history of broken noses or deviated septum issues, and if they can swallow well and drink water. The next thing that I will do is explain the procedure to my patient and let them know what's going to be happening, put them in a high Fowler's position, which I already have them in right now. Check their name, date of birth, have them they'll tell me, I'll compare it with their armband, and then I'll obviously have introduced myself before I've told them what's going to happen. So now that I've got them in place, I'm going to wash my hands and provide privacy for my patient. And then the next thing that I will do is make sure that there is a towel on their chest, just in case things get a little bit messy. And then I'm going to take my NG tube that I'm going to be putting in and measure it on the patient to see how far we're going to need to go in. So I'll start at the tip of the nose, go to the base of the earlobe, and then down to the base. We'll redo that. And then down to the base of the xiphoid process, which is about 55 on our little tube right here. So now that we know what we're going to have to do for that, we're going to prepare our tape. So I have ripped just like a 1-inch piece for my temporary, and then for my keeping the NG tube in place once I have it in, I have about 3 to 4 inches of tape all ripped up the middle except for 1 inch. And then I have already washed my hands, so I'll go ahead and put on some procedure gloves, just some clean gloves. Once I have my gloves on, I'm going to lubricate the tip of my NG tube like about 4 inches or so. In the clinical setting, I would use KY jelly. For this mannequin purpose, I'm going to use this type of lubricant. So now that it's lubricated, my patient's good to go, I'm going to assess. I've already assessed and looked into each septum and made sure that I know which side I'm going to go into, which side has like the most area for me to put the tube into. And so now that we've done that, we're ready to go in. So just following the base of the floor of the passageway, kind of pointing towards the ear of the side that we're going in. We'll go in. Once I feel, and while I'm going in, the patient's neck will be hyperextended. Once I feel a little bit of resistance, I'll have my patient put their head down, and then I will offer them water, and I'll have them take a sip, a few sips, and each time they take a sip, I'm going to go in 2 to 4 inches. So sip, sip, sip. Okay, so now once I have it in, they can relax their head. I've got it in. So I'm going to temporarily place a piece of tape on here just to keep it in place while I test it and make sure that it's in a good spot. So while that's temporarily placed on, I'm going to do 2 things. I'm going to listen to my patient's abdomen and inflate 10 to 30 milliliters of air into my syringe, and then while I'm listening to their abdomen, I'll put it in. And when I put the air in, I'm just listening for like a gurgling sound and like listening for that air going into the stomach to make sure that I got the tube into the right place. And then after I've done that, I will take my syringe and hook it to my tube and just draw out some gastric contents. Just enough so that I have enough to test it on a pH strip. So I'll just get a little bit out. And then, so once I have the gastric contents out, I will get a pH strip. And put a little bit of the gastric contents on the pH strip. And then compare it to the pH levels on the side. I want it to have a low pH because I want the stomach to be acidic. And if it has a low pH and it's swell and acidic, we're going to know that the tube is in the gastric compartment. It's where we want it to be. So now that it's where we want it to be and it's good to go, we can take off this temporary taping. Get rid of that. And then I'm going to want to kind of make sure the tube is in place. And I'm going to wipe off the nose with an alcohol prep pad, just so that it's not oily and so that the tape that I'm going to put on to secure it for a long period of time is going to stay. So I'll start by putting the 1 inch that's not ripped in half on the top of the nose, and then I'll take one of the pieces, wrap it around and come back up around the tube, take the other side, wrap it around the tube, and come back up. And once it's secured in place, I want to make sure that it's not laying on their face, it's not pulling anything, it's just going right in. There's no resistance anywhere, there won't be any skin breakdown or anything like that that we need to worry about. So now that the tube is in and it's in place, I will go and document.